G-tube feeding by the gravity method, using a legacy port. In this video, you will learn what is a G-tube and why you may need one, how to feed yourself using your G-tube, how to prevent your G-tube from getting blocked. This video shows a caregiver helping a patient with her G-tube. Some patients may not need help. You may be able to use the G-tube yourself. This video will use the word "you" to describe actions you or your caregiver can do. What is a G-tube and why you may need one? If you have an illness, side effects, or had surgery that makes it hard to eat and drink, you may get a gastrostomy tube, also called a G-tube. A G-tube allows formula is liquid food, water for hydration, and medicines approved by your doctor to go directly into your stomach. A G-tube is a thin, flexible tube. One end is placed in your stomach, and the other stays on the outside of your body. A G-tube has several parts. The balloon is filled with sterile water and keeps your G-tube in place inside your stomach. The bolster is a piece of soft plastic that sits on top of the exit site. The bolster keeps your G-tube from moving further inside your stomach. The exit site is the area of skin on your belly under the bolster where the feeding tube comes out. The end of your G-tube has 3 ports that may look like this. This type of port is called a legacy port. The feed port is where you will give yourself formula. It may have a label that says feed or feed only on it. The medicine port is where you will give yourself medicine if needed. It may be slightly smaller than the feed port or have a label that says medicine or enteral meds only. The balloon port. Only a nurse or doctor should use this port. Incorrect use could cause the G-tube to come out of your stomach. This could lead to a serious infection or the need to have the G-tube reinserted or replaced. Never use this port. How to feed yourself using a G-tube. This video will use the words feed or feeding to mean giving yourself formula. There are 5 steps to feed yourself through your G-tube. Step 1. Clean your work area and gather supplies. Step 2. Flush your G-tube. Step 3. Feed yourself formula. Step 4. Flush your G-tube again. And Step 5. Clean up after the feeding. Step 1. Clean your work area and gather supplies. Choose a clean and dry work area, like a table. It should be next to a chair so you can sit during your feeding. Before you put down your supplies, clean your work area using a disinfectant wipe or soap and warm water. Cleaning the work area prevents you from getting an infection from germs on the surface. The supplies that you need for feeding are formula. Formula usually comes in a can, bottle, or Tetra Pak box. You can buy formula at most pharmacies. Make sure that you only use a formula approved by your doctor or dietitian. Your doctor or dietitian chose a formula for you based on your diet-related needs, medical history, and current health. Talk to your doctor or dietitian if you have trouble finding the approved formula. Also, if you see a different formula that costs less, ask your doctor or dietitian if it is right for you before using it. Do not put blended or pureed foods or liquids other than water into your G-tube. Anything other than formula, water, or approved medicines can block the G-tube. Make sure your formula is at room temperature. Cold formula can cause pain or cramps in your stomach or belly area. If your formula is cold, let it warm to room temperature for 30 minutes. Do not leave open formula out for longer than 8 hours. Germs grow faster at room temperature. Leaving the formula out for longer than 8 hours increases your risk of getting sick. Do not heat formula up in a microwave or on a stovetop. If it is too hot, it can burn you and damage the G-tube. The next supply is a glass of room temperature water. Room temperature water is used to flush your G-tube. Like the formula, make sure your water is at room temperature, not too cold or hot. A 60 milliliter syringe with a 3 centimeter catheter tip. You will use the syringe to flush your G-tube. A clamp your healthcare team gave you during your G-tube education. A feeding bag. The parts of the feeding bag are the plastic bag with a lid, which holds the formula, the drip chamber, which lets you see how fast the formula is flowing through the tubing, a roller clamp to adjust the rate that formula flows, tubing with a tip to connect to your G-tube, somewhere to hang the feeding bag. The bag must be above your shoulder height to help the formula flow more easily. Some places you can hang your bag from are an IV pole, a coat stand, a hook on the wall or ceiling, a clothing hanger over a door. Clean towel or paper towel. Use a clean towel or paper towel to protect your clothes from stains and spills. After you gather your supplies, wash your hands with warm water and soap for 30 seconds. Always wash your hands before using your G-tube to prevent infections. Dry your hands with a clean paper towel. Use a clean paper towel as it is cleaner than a hand or dish towel. Step 2. Flush your G-tube. You must flush your G-tube with water before and after you have formula. Flushing your G-tube cleans it, keeps it working well, prevents it from getting blocked, and keeps you hydrated. You may be asked to flush your G-tube in between feedings to get enough water during the day. Talk to your healthcare team about how many water flushes you should do. To flush your G-tube, remove the cap from the syringe. Place the tip of the syringe in the water. Make sure the tip of the syringe is below the waterline so that no air gets into the syringe. Fill the syringe with 60 milliliters of room temperature water. Aim the tip of the syringe up in the air. Squeeze a tiny bit of water out of the tip to make sure there is no air left in the syringe. Clamp your G-tube with the clamp. This will stop fluid from spilling from the G-tube when the cap is removed. If you have lost your clamp, you can pinch the tubing of your G-tube into a V shape using one hand. Stop pinching the tubing when the video says to remove the clamp. With the G-tube clamped, remove the cap of the feed port. Keep the G-tube clamped and insert the tip of the syringe filled with water into the open feed port. Remove the clamp. Slowly push the plunger on the syringe so the water goes into your G-tube. Take at least a minute to empty the syringe. Once the syringe is empty, clamp your G-tube again. With the G-tube clamped, remove the syringe and put the cap on the feed port. Take the clamp off your G-tube and put the cap back on the syringe. Only use water to flush your G-tube. Any other liquids besides water, formula, and approved medicines could block your G-tube. Step 3. Feed yourself formula. To give yourself formula through your G-tube, first, shake your formula so that it is mixed well. Unmixed formula can block your G-tube. Open the formula and place it on the table. On the feeding bag, close the roller clamp by moving it downward. This stops formula from moving through the tubing. Use one hand to hold the feeding bag and the end of the tube. Hold them upright so the tube makes a U shape. Open the lid of the feeding bag and pour the formula into it. Close the feeding bag lid. Hang the feeding bag above your shoulder when you are seated. Squeeze the drip chamber so it is half full of formula. Slowly open the roller clamp by moving it upward until you notice the formula moving through the tubing. Take the cap off of the tip of the feeding tube and aim the tip into the empty formula container. When the formula starts to drip from the tip of the feeding tube, close the roller clamp and place the cap back onto the feeding tube tip. If the formula is not flowing, add water to the formula in the feeding bag to make it flow better. You can add up to 1 cup of water, 250 milliliters, each feeding. If the formula is still not flowing, try any of these 3 methods. Squeeze the feeding bag lightly. Open up the lid on the feeding bag to allow some air in, and squeeze the drip chamber. Before you start feeding, sit upright on a chair. Place a clean towel or paper towel under the end of your G-tube. Clamp your G-tube using the clamp. With the G-tube clamped, open the cap from the feed port of your G-tube. Keep the G-tube clamped. Take the cap off of the feeding tube tip and place it into the feed port. Remove the clamp from your G-tube. Slowly open the roller clamp until the formula in the drip chamber is dripping at about 1 drop each second. You can adjust the speed to go slower or faster. Moving the roller clamp up will make the formula drip faster, and down will make the formula drip slower. If you start to feel too full or nauseous, like you need to throw up, close the roller clamp slightly. Remain sitting until the feeding bag is empty. Do not lie down during the feeding or for 1 hour after you are done. If you lie down, the formula could back up from your stomach and go into your lungs. When formula goes into your lungs, it can damage them or cause an infection. This is called aspiration. During the feeding, you can do gentle activities like reading or watching TV. When the feeding bag is empty, first close the roller clamp, then put the clamp on your G-tube. Remove the tip of the feeding tube and place the cap on the tip. Close the feed port of your G-tube and remove the clamp. Remember, after your feeding, do not lie flat for 1 hour to lower your risk of aspiration. If during your feeding or soon after you have diarrhea, loose or runny poo, nausea, feeling like you need to throw up, or acid reflux, also called heartburn, contact your healthcare team. Step 4. Flush your G-tube again. Once you are finished feeding, flush your G-tube again with 60 milliliters of room temperature water. To flush your G-tube, follow step 2 of this video. Always flush your G-tube after feeding to make sure it does not get blocked. Step 5. Clean up after the feeding. Rinse your feeding bag with water after each feeding so no formula is left in the bag or tubing. At a sink, open the top of the feeding bag and fill it with water. Close the lid and shake the bag. Empty the bag into the sink. Repeat this step 1 more time. Then, fill the bag with more water and close the lid. Hold the bag above your head or put it back on the IV pole to get the water to run through the tubing. Remove the cap from the tip of the tubing and open the roller clamp. Make sure you hold the end of the tubing into, but not touching the sink, and let all the water drain out of the feeding bag. If there is still formula in the bag or tubing after you've rinsed it, repeat these steps until there is none left. Hang the feeding bag and tubing to dry. Rinse the cap of the tubing tip and let it dry on a clean paper towel. At the end of the day, repeat the same steps, but add a small amount of liquid dish soap to the water. Do not use any other cleaning products. Rinse well to make sure all of the soap is removed. Your feeding bag and tubing are ready for use the next day. Clean your syringe at the end of the day. Wash the syringe with warm soapy water. Take it apart and rinse with water until the soap is removed. Allow it to air dry. Replace your feeding bag and syringe every 7 days. The bag and syringe can become dirty even if they get cleaned. If they get discolored or harder to use before 7 days, replace them earlier. Ask your healthcare team how to get new feeding bags and syringes. How to prevent your G-tube from getting blocked. To prevent your G-tube from getting blocked, flush your G-tube with 60 milliliters of room temperature water in the morning and night, even if you do not use your G-tube. Flush your G-tube with 60 milliliters of room temperature water before and after a feeding. No food or drinks other than your approved formula and water should go into your G-tube. Always shake the formula well before using it. Do this to make sure it is mixed well. If your G-tube has come out of the exit site, do not try to put it back in. Cover the exit site with gauze if you have some close by, or use a clean face cloth. Go to your nearest emergency room right away. For more information about your G-tube, including what you have seen in this video, review the Tube Feeding by Gravity brochure. You can get a copy of the brochure online at uhn.ca. Search Tube Feeding by Gravity or scan this QR code. At the Princess Margaret Patient and Family Library, or by asking your healthcare team for a copy. Talk with your healthcare team about any questions or concerns you have.